need you guys to give a testimony and talk a little bit about so far your experiences from the training that we've been having and everything that we've had thus far. So give us just a little testimony of, you know, what you think you need to work on, what you like, enjoy about, you know, the training, and what's been the most challenging part of the training. Tell us your name too, everybody.
Well, my name is Raheem, and most challenging thing that I had to do in this workout was what was it? Push-ups. Yeah, that really was the one. I couldn't do a push-up correctly, and now, yeah, I'm able to do it correctly now, and now, yeah, I'm able to do it correctly, and it was challenging when I first started because I got quicker actually when we were doing the running on the field. That's really, yeah, it was.
Ryan, where are you in high school? Here?
Yes.
And you're what year?
My junior year.
Your junior.
My name is T.Y. I'm a junior here, and the toughest part of this training was the wheel abs. I think that's what it's called.
Core.
Yeah, when we was doing ab work, we had to do some crazy stuff. Huh? Yeah, windshield wipers. That not one hand.
That was hard for you?
Huh?
That was hard for you?
Yeah, that's the hardest part. And
It wasn't really hard.
Hey, let him go ahead.
I'm sorry.
and the good thing was it was kind of sensational. Yeah, sensational.
And man can dunk, for those of you who are in the room. I watched the one go down.
Oh, okay.
I'm Deontay. The hardest thing that was for me that I did in strength and conditioning training was me trying to get my stamina straight. After a couple of weeks or so doing that, we had a game, and I saw how it really helped me hustle more, get down the court more, make myself available for the team. And the other hardest part was doing the windshield wipers with coach.
You're also a junior?
I'm a sophomore.
You're a sophomore?
The practice was real intense, but it's helping us get through games and stuff, helping us hustle more, helping us become more together as a team, build our chemistry, and stuff like that.
What was the last question?
Most challenging, you said that. What you like the most?
What I like the most is how everybody just came together as a team. And we just built relationships with each other, and we help each other get through the training for the ones that was hard for some of us. And we push each other a lot. That's what I like most about doing strength and conditioning. That's why I come every day, because I like people pushing me to be at my best.
Yeah, little country.
Dwight.
What's up? My name is Javon. Everything. When we first came, when we first started doing the workout, it was crazy. We had to do all these push-ups, back, non-stop. I couldn't feel my body. I was sore. But other than that, I was like, although it told me even when I'm tired, I keep pushing myself harder.
Javon, what year are you?
Your junior.
Thanks, fellas, for.
This is Jerry up, guys. This is not Jerry up over there. What was hard for me was when I first started was basically really the push-ups, because it was something I wasn't used to. We was doing all types of different push-ups, and I'm when we started doing this, it was hard because I couldn't do it for them. But I really like this program because it really gets you better. It really makes you stronger, faster, quicker, whatever. And you do a lot of things to get you better.
My name is Gerard. When we first started, like Deontay said, I don't want me dreaming. Everything was hard, basically. I never really had the experience to do all that. But I know I ran track, so I already had the stamina. I know each and every week I'm getting stronger, quicker. And it worked in the game. But basically, I like what Deontay said too. I like our chemistry getting better every week. We pushing each other. So, yeah.
My name Khalil. The workouts was also hard. I also ran track. Me, Bristol, and Raheem, we also ran track. So my stamina is also okay. But what I liked about the program, honestly, the creativity behind the workouts. Like they was hard and all that, but the workouts at the end of the day, they still helping you out. And that's what I like about the whole program. Cause it's helping you out at the end of the day. Yeah.
Fellas, while we're here today, more than just strength and conditioning to take care of your bodies. And today, we are blessed with two healthcare providers that I have relationships with that are here today to talk to us a little bit about what more it takes to be healthy and live healthy, not just your strength and conditioning. And that's a big piece. Obviously, you want your body to be in shape. You want, your lungs to be good, your heart, your conditioning, everything to be good, your muscles. You don't want a lot of fat on you. And so, especially when you're playing sports. And so, that's a big piece to it. But, we're here today so we can hear a little bit more about the health piece, a little bit more. All right, so today we have Mr. James Davis from Riverside Health.
Cinda Chase.
Ms. Cinda Chase from Riverside Health as well, and Mr. Chris Maynard from Total Health Care. And they're all going to share a little bit about their programs. James Davis to come up and share a little bit about what he knows in his profession about healthcare.
Thank you. I can't overrate it, so wait, hold your applause. But first thing, I mean, what I just heard you guys talking about all this stuff, I know you already know this, but the things you're learning really are going to make a difference in your life. Challenge, adversity, goals, and achieving them, and it really is a mind, body, spirit thing. And I'm not, we're not always well, in our mind, in our body, and our spirit, but you have to work at it.
About the dentist. I come from a dental background, so I'm going to talk about dental. The thing is, I know some people don't go every 6 months. Do you guys go every 6 months? No. Okay. One person goes every 6 months. Oh, you go? Okay, we got two? Okay. And the thing is, I know a lot of times people say, oh, dental, it's no big deal. My teeth aren't hurting. I'm good. Well, honestly, with your teeth, you get things, you get tartar, plaque buildup. If that gets below the gums, what that is, that's an active infection. So if you have a cavity, you may not feel it. Most of the time when you feel a cavity, it's actually because it has went down to the nerve, and it's touching the nerve of the tooth. That's why you're feeling pain from a cavity, okay? And that's why going to the dentist every 6 months is so important. Our teeth are constantly changing. You use your mouth to eat, to drink. You're constantly putting things in your mouth. I know a lot of people do not floss. Who flosses in here every day? Okay, who's lying? Who's lying? Oh, and some people didn't put their hand. Okay. Flossing, honestly, is one of the most important things you can do. Because the thing is, that toothbrush is not going to get in between your teeth. If you're not going to the dentist, that's one thing. But I can guarantee you, if you don't floss, maybe not tomorrow, maybe not 6 months from now, but over the next couple of years, you will have cavities in between your teeth. I mean, I could probably put $100 on the table and bet that if we come back 5 years from now and you haven't been flossing, I can promise you will have a cavity in between your teeth. That is one of the most important things you can do, along with seeing the dentist. I mean, like they say, an ounce of prevention is worth a pound of cure. And the thing is, I mean, dentists can actually look in your mouth and see if you have diabetes. So that's really how the whole body is connected. A lot of people don't think, with dentistry it's not important, but really, a healthy mouth is a healthy body. If you have infections going on in your mouth, chances are you're going to end up with different infections because your body is in a constant battle, trying to fight off the infections that are in your mouth, which is plaque and bacteria. What man is making that in his nature. So, that's one thing that we decided. And then also, one of the things that does make us different, there is an issue in Maryland where some folks are actually addicted to pain medications and heroin. You've probably heard of it, seen of it. maybe knew someone who had that problem. We actually cover acupuncture with that, which makes us different because they actually found that that helps, you know, with the withdrawals and the cravings and different things of that nature. So basically that's the coverage. And like James said, we do a lot of stuff in the community. Me, myself, I go out and I do educations with everyone from the little guys to seniors to different community organizations. We always participate in health fairs, parent meetings, you know, all that kind of good stuff. So, do you guys have any questions?
No.
Are you guys worried about insurance or your health? Yes. Do we go for physicals every year?
Yeah.
Okay, so right now. And also that's another thing, guys, when you get older, please continue that, you know, getting your physicals and things like that, you know, through your health insurance. Because a lot of times stuff goes on within our bodies that we're really not aware of. You know, I mean, right now you guys are physically fit, in great shape, you know, you exercise, but hereditary plays a role in things. So if you've had parents that have maybe had high blood pressure, you know, or maybe grandparents that have had high blood pressure or diabetes, something like that, a lot of times hereditary plays a big role in that. We go through that, you know, oh, I gotta cut 10 pounds. And I'm like, okay, you're 5'9", 148, but okay. Where are you cutting 10 pounds? I haven't figured it out. But yeah, so, you know, but again, like I said, you know, it's really important when you guys get older. I mean, right now, you're teenagers, you kind of feel invincible, you know, you're gonna live forever. You're never going to get old. You're never going to have to take medication. We all believe that. You know, at 16, 15, 17, you know. But the thing is, you know, when you get older, you want to make sure that you really, you know, take care of your health and look after it. Because at the end of the day, you're stuck with one body. And, you know, the thing is, you can be either, you know, when you hit 50 or 60, and I know that's 1,000 years from now, it seems like, but it'll come before you know it. And athletes, then. Oh, you have
I got a question. With dairy and trying to receive calcium. Now, you know, from my experience and, you know, training and actually being a professional athlete, dairy isn't the greatest, you know, to actually take into your body. You know, what other forms of calcium can athletes take?
Actually, green leafy vegetables, collard greens, kale, spinach, broccoli, all of them are very high in calcium. If you don't like to eat your vegetables, and some of us don't, then you can use a supplement. There's been a lot of controversy around the calcium supplements because traditionally the calcium supplements, what they used to use was limestone, coral, and like the shell from shellfish. And that's how the old vitamins used to be. That's why if you're going to use a calcium supplement, I'll get into the other part of that. You want to make it sure that it's like vegan, like made from vegetables. You can get them usually at health food stores. Because the thing is, although we've evolved as humans, I've never known humans to eat rocks or stones. So limestone, taking the calcium, and that way it was a lot of controversy like recently around that. You know, although we've evolved, that limestone, it doesn't get absorbed into the bones. And I mean, of course, it has a longer term on the vitamins, you know, unless it says vegan. Because, you know, the limestone, what it actually does is it sits on your bones, it doesn't get absorbed, or it can go into your arteries. And so that's why it's been a lot of controversy surrounding that, because your body can't really absorb stones and coral and, and shells, you know. So the thing is, you know, if you're not going to eat those vegetables, you know, then you want to look for, you know, a calcium supplement that is vegan. It also has to have vitamin B in there for your body to absorb it, vitamin K, and vitamin C for your body to completely absorb it. So, you know, that's it. And again, you know, and of course, sometimes if it gets to a point where it's so low, you know, if your like bone density is not where it needs to be, then your doctor might prescribe a prescription for you. But as far as over the counter. So, but again, that's why like the physicals are so important, because a lot of times we really don't know what's going on with our blood. Also, the thing is, with all the fast food that everyone eats, a lot of times you can have high cholesterol. What does high cholesterol lead to? Heart disease. You know, so again, you always want to watch, you know, the fatty foods that you're eating. I mean, it's easy to run out and get a hamburger and french fries, but at the end of the day, I mean, french fries are cooked in a whole pan of grease. They're potatoes, they absorb all the grease, they taste good, I like them, you know what I mean? But they're not the most healthiest choice for us. So, and also we do have some information up here about some healthier snacks to choose. You know, and especially with you guys training, I mean, this time of year when you're training, you gotta eat healthy, and you might as well just let it follow you through life. Any other questions?
Yeah, but, you know, because I notice sometimes when some of the fellas are training, that, you know, they may be a little sluggish. Anybody recognize that sometimes when they train?
Yeah.
Before you come out there, that you may be a little sluggish, you know, a little faint, you know, might not have enough nourishment in your body.
Yeah.
What do you suggest that, you know, they eat before their training sessions, you know, and throughout the day, especially with, you know, being in public, in school, and not receiving the best, you know, meals at lunchtime?
Yeah. A lot of times, like, you know, proteins, I'm a big fan of any type of protein and vegetables, you know, and fresh fruits. You know, an apple has a lot of fiber, and apple will help hold you over. You know, and also, if you do any of you guys take a multivitamin? Okay, so some of us do. I definitely recommend multivitamins because really, with all the vitamins that you need in a day, you don't take in really what you need. You know, in the way of food. So, you know, that's my thing, a multivitamin. You know, I'm not in favor of sodas at all, or caffeine. I know a lot of my friends like to drink soda and caffeine and Mountain Dews and all that good stuff. I'm not in favor of that, or a fan of that. You know, the thing is water, and again, you know, salads, meats, proteins. You know, you definitely want to keep that protein up.
So like Joe was saying, what about little packs of nuts and things like that?
Yeah. Yeah, I mean, nuts are a good snack, a good option, you know, the protein packs. Yogurt is another.
I really don't eat nuts.
You don't eat
I
I think it went sideways.
I
Jake.
know.
Not yet.
Hey, I
It
was
went
in the
sideways.
deal for
I get foolish, man. Mention bananas and they go crazy.
I don't really eat nuts.
Notice I didn't say that.
Yeah. But that is a good one. Bananas actually do give you energy, like an energy boost. Yeah, it is.
They are at every event. We're at them and Damen. But first things first, how many push-ups should I do for letting Coach kind of, in spite of my shoes, kind of get by me on that one?
50.
No, I'm not doing 50.
10.
10, I can do 10. Okay. All right, I'll do 10.
20.
Here we go. 1,
10.
2,
It's a
3,
Yeah.
4, 5. Come on, 6. 7, 8, 9, 10. All right, 11. All right.
All right. I had to because I was like, if you guys are talking about push-ups, I'm like, I gotta take one for the team because I definitely got it. The next time I'm wearing the right shoes. So anyway, I'm an old man now. What she's talking about, I've got high cholesterol. I play sports. I tell you what, these are important things to work on. Get used to this stuff because it happens. Another thing about being a man, men's health. What I played college soccer and high school baseball and I played pickup hoops once in a while, as you can tell. My shot's not great, but I can try and rebound now and again. So I'm going to treat you guys as men because to me, you're men. So what does a man mean? What does that mean to you? What?
Responsibility.
For who?
Yourself.
And? Right? Potentially you're going to be fathers, right?
No.
No, one day, right?
No.
Okay.
No.
Dude, I tell you, I said the same thing. I got a 9-year-old, so. Okay. All right. Well, I hear some of you are. So what we do at Total Healthcare is we are the place to give you health care when you sign up with Group Like Riverside. Hey, so serious moment for a second.
Listen up.
Mondama Mall, right there. We treat thousands of patients a year. Some go downstairs because they got mental health issues. Some are addicted to alcohol and drugs. Some are just you guys, just checking in on your health. Some are moms and dads who've got a sick kid. It's right there. We have 9 locations. We are here. We serve Baltimore. We serve West Baltimore. That's why we exist. I met Joel at a basketball camp with Chu Smith this summer. And talk about running some kids ragged. I think they needed our clinic after that. You guys know who Chu is? Globetrotter? Man, he worked those kids, right? A lot of kids came in and thought they were in good shape. I don't think they were so confident after it.
Right.
But no, health's important because if you're not the example to your kid, your family, they're going to look at you. I mean, you guys are all in great shape, and you talked a lot about teamwork. Well, when you become a dad or you become someone in an office, you can't make money if you're not healthy, right? If you call out sick, guess what? Sorry, man. Got someone else to replace you. Love you right now, and you guys should remind me to get out there and play a little more hoops, right? But this was a good wake-up call for me today. But seriously though, this man cares about your health and wellness. You guys might not all make the NFL, but you can all be healthy. You can all make good life choices. And you know, if you need us, Total Healthcare is there to provide it right here and in 10 other locations. Now, you guys are hooping, doing whatever you're doing. Going out with the ladies after. Hand sanitizer. Eating dinner. Hand sanitizer. Because guess what? Bacteria with broccoli doesn't really work so well. So there you go. So now, and our stuff is on it. If you want to ever look up where we're located besides Mondawmin, besides Division, 10 locations. Someone in your family's addicted to alcohol or drugs. Let's get serious for a moment. It's not getting a checkup. It's not just going to see the doctor for a pediatrician. Call us. We do counseling for families. Listen, guys, half the people walking around this block over here are addicted to opiates and drugs and alcohol. Some of it's not their fault. I'll tell you what, they walk around like zombies. Don't let that be you. Don't let that be your family. That's what we're here for. We do a lot of mental health and drug counseling. We exist to work with them to do those services. So we also provide dental, and I have other stuff if you want to find out about how to enroll in insurance. If your family hasn't done that, I'm still out of breath from those push-ups, but I'll get there. But yeah, so come on up and talk to us if you have any questions. But again, I hand you those things even though you're 15, 16 because you're men. You're responsible men. You wouldn't be here doing what you're doing. I love your testimonies because you spoke about teamwork and yourselves. And we're just here to help continue that path, man. You guys are on the right path. Love it. Thank you. Proud of you. Yeah, okay. You track that
This
too?
talks about the benefits, right?
You're the scrappy guy.
You're welcome.
So yeah, if you guys just found out.
This is about our name changing. We're actually owned by the University of Maryland. They purchased us.
I know, yeah, I'm not rushing back.
Wait, so it gets on the plate. Okay, go ahead.
Is it called Give me a call.
Go to Jimmy.
Alright, so those might be the worst push-ups you've ever seen, but
I didn't think that at all.
it had to happen.